Dementia is a very broad term, and what dementia means is that an individual has loss of cognition in two or more areas of cognition in their brain. So memory and language skills, or memory plus judgment. And if the loss of those cognitive abilities is severe enough to affect day-to-day function, we call that a dementia. Now, it turns out that Alzheimer's disease is by far the most common cause of dementia, but there are many other forms of dementia. Dementia and Alzheimer loss, unfortunately, are quite common, and it is age-related. So by age 65, about 5% of people will have a dementia. By age 75, it's up to about 10% of all people will have a dementia. And by age 85, 40 or 50% of all people will have some form of dementia. The risk factors for a dementia include genetics. On the average, each of us has roughly a 5% lifetime risk of coming down with Alzheimer's disease. If you have one parent with Alzheimer's disease, your risk goes up threefold. Epidemiologic studies show that the more education that a person has, the less likely are to have a dementia. A third risk factor is head trauma. People that have had head trauma, particularly severe enough to be associated with concussion, are at higher risk for dementia. The primary or early symptoms of a dementia, including Alzheimer's disease, most often consist of some form of memory loss, particularly with recent events. So the person will ask the same questions over and over again. They'll forget about something that had happened just an hour ago or yesterday. The remote events from early in their life are often intact initially. It's the recent events that they forget. Other examples include the loss of what we call executive function, the ability to plan and execute. So for example, if somebody was previously able to prepare a meal that had 3 or 4 parts and they're multitasking, their ability to prepare that meal will become impaired. A third early symptom could be personality change. They become withdrawn, and it's just not them. Another problem would just be lack of verbal ability or verbal output. They're no longer able to express themselves. Another problem is what we call visual spatial skills, often manifests with driving problems. They just can't visually put their environment together. Or spatial skills, they get lost in familiar places. People often want to know, are there any signs early in life that they'll come down with a dementia or Alzheimer's disease? It's one of the biggest questions in our field. On a research level, there are certain approaches to brain imaging that might predict that someone is more likely to come down with Alzheimer's. But right now, for somebody in their 20s or 30s or 40s, there's no reliable way to predict who will actually get dementia, although there are ways to know if someone's at increased risk. There are a considerable number of studies showing that exercise, physical exercise, makes a big difference. People that are physically active have about a 40 or 50% reduced likelihood of coming down with Alzheimer's and some of the related dementias. That's a huge effect. The second strategy is healthy diet. There are a number of studies out there now showing that the so-called Mediterranean diet can reduce risk by about 30 to 40%. And then a third strategy is remaining cognitively engaged, cognitively active. You'll hear the example of crosswords puzzles, but it doesn't have to be that. It's just keeping your mind engaged with something interesting in your environment. So in terms of specific treatment options, I would put those in several categories. One goes back to just the overall lifestyle, getting enough exercise, physical activity, remaining engaged cognitively with one's environment, and diet. There are currently 4 FDA-approved medications that a neurologist or other physician will work with. They can make the cognition work a little bit better and delay things by 6 or 12 months. The third area to think about if somebody does have a diagnosis of Alzheimer's is entering a clinical trial to test an experimental treatment. One exciting area is the ability to detect this disease as early as possible. One area involves brain imaging, and we're fortunate here in Stanford we have some of the leading brain imaging people in the world. A second exciting research area is looking at patterns in the blood that can detect early processes that might lead to dementia. And finally, the sort of new generation of treatments for this disorder attempts to go beyond just symptomatic treatment, but really attacking some of the underlying mechanisms that are causing the brain degeneration. And there are a number of teams here at Stanford that are making great progress in that area. None of these are ready to be clinically available to patients yet, but that's our goal.